Policy and regulation. Although the EU often provides a framework for policies and regulations, any member states may have their own specific policies and regulations. The EU upholds the principles of human rights and non-discrimination in all policies and regulations related to older adults. This includes protecting older individuals from age-based discrimination and ensuring their equal access to healthcare and social services. Several EU member states embrace WHO's Age-Friendly Cities and Communities framework, striving for inclusive, accessible environments for all ages. Age-friendly cities consider accessible transportation, safe pedestrian infrastructure, affordable housing, healthcare, public spaces, and civic engagement, to cite a few. The EU has been working to improve the quality and accessibility of long-term care services for older adults. Ethical dimensions in this context include ensuring dignity in care, respect for personal choices, and safeguards against older adults' abuse. Dignity in care can be improved by training and education for healthcare professionals and caregivers on the principles of dignity in care. This training should emphasize respectful communication, cultural competence, and understanding the unique needs and preferences of each individual. Given the importance of technology in the silver economy, policies aim to promote digital inclusion among older adults. This includes measures to bridge the digital divide and ensure that older individuals have access to digital services while protecting their online privacy and security. To bridge the digital gap, offer tailored digital literacy programs for older adults and enhance the user-friendliness of digital devices and software interfaces. Train older adults on safety and cybersecurity as they are particularly vulnerable to cyber abuse. Work to make internet access more affordable for older adults, especially those on fixed incomes, is also a key ethical point. The key policies are in place to protect the financial well-being of older adults, including pension rights and financial literacy programs. Ensuring fair and ethical treatment in financial services is a priority. This last point could be achieved by strengthening regulatory oversight to ensure that financial institutions and service providers adhere to ethical standards when dealing with older adults. Regulators should have clear guidelines and enforcement mechanisms in place. The EU and its member states have regulations and initiatives to prevent and address elder abuse, including physical, psychological, and financial aspects. These policies aim to protect the rights and dignity of older individuals. Healthcare policies consider the unique healthcare needs of older adults, including preventive care, age-appropriate treatments, and palliative care. Ethical considerations in healthcare include informed consent and patient-centered care. These considerations should include the respect for patient autonomy as a foundational ethical principle. It means that individuals have the right to make informed decisions about their own health care, including the right to consent to or refuse medical treatment. Healthcare providers should provide patients with clear and understandable information to support their autonomous decision-making. Ethical considerations in end-of-life care are an important point in the policy and regulations. These include respecting patients' wishes regarding advance directives and do not resuscitate orders. Healthcare professionals must address issues of withholding or withdrawing life-sustaining treatment and provide palliative care for patient comfort and dignity at end of life. Ethical policies encourage active participation of older adults in decisions affecting their lives, such as healthcare, housing, and community planning. As technology grows in the silver economy, data protection and privacy regulations become crucial to safeguard older adults' personal information. Regulations are in place to protect older consumers from fraudulent practices and ensure fair treatment in the marketplace.